Hey everybody, welcome back to Health Matters. I'm Ryan O'Connor. These are proudly brought to you by Cipla. We have managed to get one more from the good doc. Thank you very much to Dr. Konrad von Hagen, who joins us again, parting with his expertise from many years of being associated with South African sport, now being able to give back and join us via these podcasts to impart some information. Doc, lovely to have you back. The one important thing I want to talk about is sport at school. Oh, we know we're on the sidelines screaming for our kids to do their best out there, but we see loads of injuries amongst children, and it is a problem.
I think sport is so important for children, and all children must do sport. So in whichever way, must do something physical, and that's where it's important. But unfortunately, we know how competitive everything has become, and we know where we're at. So children's sport, obviously having 3 of my own, is very important to me, and I do have a daughter that's a little bit over the top when it comes to sport. So if she gets injured, they all look at me and say, why? So I need to practice what I preach at home as well. So I think a big thing for us is to remember children are not little grown-ups. It's a total different system, immature system, physically and mentally, that we're dealing with. If you look at it, the endocrine system is not fully developed yet. So they've got different stages. When in girls the estrogen and boys the testosterone change. So you'll have phases where you are more prone to stress injuries like stress fractures in your back, etc., in your legs when you run too much. So we need to take that into account. And also the bones are still growing, and they've got growth plates, and growth plates are the areas where the growth happens. And if you've got an injury into a growth plate, it is potentially catastrophic. So it needs to be managed perfectly, and we need to know about that. And they also have their own overuse injuries because they are different. Like we call it pitcher's elbow. Kids that throw a lot. In the ankles, there are a lot. In the knees, there are a lot. And it's growth plate injuries as well, because you're just growing too quick, and the tendons aren't keeping up with the bones, and you want to look after that. And we have to give that the respect it needs. But I think looking at kids in a whole is that they must do their sport, but we must protect them.
Absolutely. Also, there's been a large push for parents to try and get their kids the quickest path to recovery. Sometimes it might not be the safest path to recovery or the most legal path to recovery. We've been exposed to a quick fix society. We know that we have kids that want things done immediately. I mean, when you and I grew up, we certainly didn't have access to what kids have access to in this day and age in terms of everything, technology, just that quick fix for everything. And often parents think, well, hey, if there's a quick fix available, I'm going to use that quick fix for my kids.
And not only the quick fix, it's also the unfair advantage.
Sure.
So I've had parents come and see me with their 15-year-old who is not growing fast enough and who's a high jumper. So now, can I please prescribe growth hormone?
Right.
And then I said, number one, growth hormone is a banned substance. And secondly, it's not going to be good for your kid if he doesn't need it.
Yeah.
I've never seen that patient again. But that happens. If you look at, unfortunately, and we're fighting it hard, it's steroid use are still out there. And it's available all over, so you don't have to have a prescription. And the dangers with steroid is we can spend all day on it. If it's used for the right reason, for somebody who doesn't have steroids, who doesn't have testosterone, etc., then it's a medical condition. So then I'm more than happy to do that, but we need to be safe with that. We've just had the Craven Week, and those boys get tested. We know we've had a few years where there were a few positive tests. So unfortunately, kids listen to other people, and sometimes even their parents are involved.
Pressure from parents, absolutely. Doctor, let's talk a little bit about, obviously there's a list of banned substances. You alluded to that now, you spoke about it now. Be very careful, parents, when administering any of that, and don't do it yourself. You know, parents often think that they're the doctors. You know, they all of a sudden they go from being a sideline coach to a expert doctor overnight, you know, as a parent. And now you want to just prescribe everything under the sun to your kids.
There's a good example that I had once, is that there's a common flu medication that if you go and Google, and I'll give you, so I use Drug Free Sport, South African Drug Free Sport. They've got the greatest mobile app. You just go in, you put medical check, and if it's green, you're allowed to use it. If it's other colors, you know you're not allowed to use it. If you're allowed to use it in competition or not in competition, it's got another color.
Yeah.
And so there's all different ones. In some sports, you can use it and can't use it. So it's a simple, straightforward, no risk. But then people go and then you know that the tablet or the effervescent is safe. But the syrup has got something else
in it.
So then he's taken the syrup and he
Got
comes
you.
and he said, no, my mom gave me that. And I said,
Nah.
luckily, we've got 3 days to get this out of the system. But this was illegal. And he would have got a smaller ban, but he was still got a ban because he was not supposed to use it. And it wouldn't have helped his performance at all.
Yeah.
But he's taken something that he shouldn't be taken.
Yeah.
So it's so risky. And for parents, just go put it in your phone, see if it's safe.
Yes.
Straightforward. You know what you can take.
Doc, specifically on rugby, and this is a hot conversation and topic to talk about in schoolboy rugby is concussion. Let's talk about the entire subject of concussion as a coach, as a parent. How do you deal with concussion?
Okay. I've got a big passion for concussion, so I can talk days on concussion. But it's not only rugby. We're going to talk about rugby specifically because that's where you see it.
Yes.
So I had one of the schools I'm involved in, we do a pre-season testing of the kids. So we tested all the rugby boys and we decided, yes, we're going to do the hockey kids as well. And then my first 2 concussions I saw were the horse riders.
No
So we didn't
way.
test the horse riders. So they fall off, hit their heads. So
course.
concussion happens everywhere. So rugby is a big one, but we must take into account it's not just for rugby.
Got you.
No. So the concussion, there's the big misnomer that you have to lose consciousness and you have to have this, and if your symptoms are away straight away, it's not a concussion. Concussion is not a test that we can go do a MRI or a CT scan and say, yes, you've got concussion. Concussion is a history of what the event was, then what the symptoms at that moment was. So by the time they might see you as the doctor, everything's gone. So that part is important. Nowadays, you've got the kids that got it on their phones and the parents have got it, so they come with their footage. Yes. They say, no, it's a concussion because of this and this. And the criteria are so well done. So at this moment, we use the SCAT-5.
Okay.
They've just had the international convention, and the SCAT-6 is now being implemented for next year. So it's a process. We don't know everything yet. Yeah. But we're learning, and I'm a practical doctor, but I listen to all the clever doctors, and I do what they say, and I implement that.
Got you.
And there's a process. So if you're under 13, you get managed differently. If you're under 19,
differently. Yeah.
Working at the Junior World Cup now.
Yes.
So our under 19s is recognized and removed. So they don't have a ding dong test. They, if I'm as the matchday doctor feel they've got a concussion, they're out.
Boom. Yeah.
And there's no way they're going to get back.
Yes.
If it's over that, so there's a different process to protect the different age groups.
Got you.
And there's not a time of you're going to play in 3 weeks. It doesn't work like that. There's a process, and it's all out there. It's on BoxSmart. It's on the concussion guidelines. It's places you can find it.
Yeah.
And if you don't know, see a sports doctor that's got a concussion knowledge. And all the sports doctors do. But don't just think, we're going to rest 2 days and then get back. So get the diagnosis, get the follow-up, and then we have a return to play. So once we're happy, we go through a gradual process of doing a little bit more, seeing if you get symptoms, and then do contact, and then clear you.
Got you.
And we can see, I read now, it's the first woman came through last week that's also now got degenerative problems brain-wise, because of all the contacts. We know you have read it in the news of all the cases, and and it's everywhere. And it's just managing concussion wrong.
Yeah.
And it starts with our kids. Remember,
100%.
It's a different, more immature brain.
Spot on.
And also in kids, now they're writing exams.
Sure.
Now it's matric exams and they're slow.
Yeah.
So we have to write letters to ask for extra time.
Sure.
Because they struggle. They can't learn.
Absolutely.
It's a huge problem, and let's just manage it right and recognize it and give it the respect it deserves.
Managing right, ending with that in terms of concussion, onto managing right in terms of supplementation And supplementation, we see it, we spoke about it briefly, about the wrong kinds of supplementation for things that, are illegal maybe, or things that aren't, advised. But there's a hell of a lot of good supplementation as well that's out there for children.
Yeah. If you look at supplements, there's definitely a place for it. But number one is diet.
Yes.
The supplements only come into play if you cannot get that in your diet. And then if you do have your diet, and your diet is insufficient, or sometimes you just don't have time, you're going from rugby practice and I'm going to swimming and I really can't eat something.
Sure.
What am I going to take then?
Yes, yeah.
And that's where it's worth spending a time with a dietitian as a once-off, seeing what is there, what is safe to use, because there's a lot of things that aren't safe to use.
Yes.
And the problem as well is that supplements, the better brands and the ones that get tested will give you a certificate and state that there's nothing in it.
Sure.
But there can be cross-contamination. So the one that you're taking could be made in the same machine where somebody else has done banned substances in, and that traces can be in yours, and you'll test positive, and you haven't done anything wrong. So not only for the bad physical effects, but then you can also test positive, and you haven't done anything wrong.
Got you. There's a lot to absorb here, and I think this is very useful, Doc. And I think on a final note, maybe, parents obviously are listening to this. They're watching this or listening to this podcast, thinking, these are my kids. We want the very best for them. But at the same time, you need to be mindful. So mindful about what's really best for them. Often you're doing what's best for you as a parent, and you're not really doing what's best for the child.
I recently had a 12-year-old boy, he just loves his rugby, and his dad's a farmer, so they are the potency people, so they play rugby.
Yeah.
They're tough. And so he came to see me, and I said, no, you're going to be out for at least 14 days, then I'm going to see you, and then we're going to start your return to play. And the boy was crying. And you can understand, it's his life. For him, it's the most important thing. So the dad phones me that evening, and he's upset. How can you say that? And I'm trying to explain to them, he's still upset. I send him stuff to read. Then I speak to some other parent who was actually there when the boy got injured, and it was a proper concussion. I said, do you actually recall what happened? And he goes back. So it took me 2 weeks of education on this one dad, and after 2 weeks he phoned me and he said, thank you so much, I appreciate it. So it's that frustration for us, because I know better. And am I just going to tell him, listen,
correct,
do what you want. So I think we as doctors and as people that are involved in it, we need to take responsibility, and we need to educate our parents. In the end, it's still the parents' choice in a sense. If it's a concussion, I will tell the school they will not play. And the school will be liable if they play with a concussion.
Got you.
Because there are rules in place there, but there are different other things. So I think it's education, and then understanding where they're coming from. But parents must also realize sometimes there's nothing you can do. You must take your chance. Your kid needs to recover. And what is the best? You want a kid that understands the difficult times and the good times.
Absolutely.
And we need to work through them.
Listen, we really are spoiled for choice, Doc. And the more I'm listening to you, the more I realize how lucky we are, South Africans, to have some of the best people involved in sports medicine and in any kind of sporting medical practice in the world. I mean, we really are on the forefront of some of the best science in the world. And we're practicing it at a school level, which for me is just amazing. We want to wonder why we've got some of the best athletes in the world. Well, I'll tell you why. We've got some of the best physicians and sporting minds that keep that next generation of sporting greats exactly where they need to be, and that's out on the field playing and loving exactly what they do. Doc, thanks for your time once again and your precious insight into our kids. A reminder, folks, give us the thumbs up if you're listening via Apple or if you're watching via YouTube. Share with all your friends, and we'll be back with yet another podcast on Health Matters, proudly brought to you by Cipla.